Okay, thanks, Leslie. Good afternoon or good noon, everyone. It's a pleasure to introduce Trish Muzenda, who's giving the noon meeting talk today on behalf of the Division of Public Health Medicine. Trish is a junior research fellow with the Research Initiative for Cities Health and Equity within the division. And the work that she's presenting today is part of a larger Nourishing Spaces project that's led by Jane Battersby of the Africa Centre for Cities, that which Rish was and is a part of. So I can share the link when Trish gets going. But the broader aspect of the project was looking at food systems, consumptions, and diet-related non-communicable diseases. So it's a pleasure to hand over to Trish to share her details of her research on her evidence synthesis research. Trish, over to you.
Thank you for the introduction, Tolu. Good afternoon, everyone. Thank you for coming. As previously mentioned, my name is Trish Muzenda, and I'll be presenting on my research project titled Mapping Food and Physical Activity Environments in Low and Middle Income Countries, a systematized review. So low and middle income countries are currently experiencing rapid urbanization rates, and this has contributed to the emergence of obesogenic urban environments. These obesogenic environments are characterized firstly by reduced opportunities for individuals and communities to engage in physical activity, as well as an increased availability and accessibility to unhealthy, low nutrient, energy dense foods such as fast food. To better understand these obesogenic environments, they can be assessed by mapping of urban food and physical activity environments, whereby the food environment broadly looks at the range of food sources and products that are accessible to an individual or community in their normal day-to-day lives. The food environment can be assessed under 5 domains listed here. The availability domain looks at the types of food that are available within a particular community. The accessibility domain looks at the ease of accessibility of these foods within at the individual or community level. The accommodation domain pertains to how food sources such as food retail outlets adapt to the needs of the community or particular individuals within a community. Affordability looks at the pricing of these of food products relative to the available financial resources, whilst accessibility looks at the personal community views at the foods that are currently available within their communities or within their space. Physical activity environment looks at the exogenous built-in natural environment features that either promote or impede physical activity in any area, and these are delineated into 4 domains. The functional domain pertains to the structural attributes of an area, such as the street network, as well as the types land use mix, as well as the types of building within that area. Safety looks at the safety features that have been put in place particularly to protect pedestrians and cyclists. So this is things such as the presence of dedicated pedestrian cyclist lanes, as well as the presence of traffic lights. The aesthetics domain pertains to the features that indirectly enhance the physical activity experience, such as the presence of greenery within an area. And finally, destinations looks at the number and types of destinations that are available within a given area that can act as an incentive for people to engage in physical activity as they travel to these spaces. The objective of the study was to synthesize the current evidence on the tools that have been used to map food and physical activity environments in low and middle income countries. We conducted the systematized review, which combines elements of a narrative traditional literature review and specifically elements from the systematic reviews. In line with systematic reviews, we identified relevant search terms that are applicable to our study. And these search terms were uniformly applied across 3 databases. The references were then retrieved from these databases and screened using Covidence, which is an online screening platform. And the references were screened by 4 independent researchers. 4 independent researchers. Okay. Our search yielded just under 9,000 references, and these references underwent Titan Apps screening as well as full text screening. In the end, we had 60 studies that met our inclusion criteria. Of these, 25 mapped the food environment and 35 looked at the physical activity environment. Looking at the geographical spread of where these studies were conducted, of the 25 studies that mapped the food environment, just over half of them had been conducted in the Latin America and Caribbean region, with Brazil having the most number of studies. For the physical activity environment, most of the studies were conducted in either Latin America and the Caribbean region, once again with Brazil conducting most of the studies, and followed by the East Asia region, where all the studies were conducted in China. There's relatively few studies that were conducted in Africa, as well as the South Asia region and the North Africa and Middle East region. We then also looked at the number of studies mapping each of the food environment domains. For the food environment, almost all of the studies mapped the accessibility domain, and accommodation was the least mapped of these. And across the studies, the Latin America and the Caribbean region, and across this domains, the studies had been conducted. Most of the studies had been conducted in Latin America and the Caribbean. We did the same thing for the physical activity environment, and we noted that most of the studies mapped the functional attributes of the physical activity environment, and with safety being the least mapped feature. In line with the geographical spread, most of the studies were conducted in Latin America and the East Asia Pacific region. We also looked at the unit of analysis for each of these studies. Units of analysis used across the studies, and we noted three levels of analysis. There's the citywide, the neighborhood, district, and the school. So for the citywide, most of the articles that we retrieved had analyzed these environments at the citywide level. So for the citywide level, the analysis was conducted.
That's why when you're in trouble and you just phone them, then you don't have to explain where you are.
So for the citywide level, the research was conducted in such a way that different neighborhoods and different parts of the city were sampled, and through the mapping exercises, they then identified any differences or similarities between the sampled neighborhoods. With the neighborhood level analysis, whole of neighborhoods and whole of the environment in whole of neighborhoods or the districts were mapped out, and at the school, the schools were identified, and then the immediate environment around the school was then features occurring within the immediate environment of the school were then mapped out. Okay. Within these varying levels of analysis, they used a mix of some of the units of measurements that I'm just going to describe now. So firstly is the housing estate units of measurement, whereby they looked at, in this particular study, they're looking at the availability. They're looking at the greenery within the boundaries of a specified housing estate. Then for the neighborhood, they demarcated, for the neighborhood measurement, they demarcated the outer boundaries, the geographical boundaries of the neighborhood or the social boundaries of the neighborhood, and then looked at the features occurring within this boundary. In some instances where either the geographical or social boundary was not very clear, studies utilized census tracts or city blocks as a proxy for neighborhoods. For the school environment, as listed here, studies identified the location of the school and then delineated sort of a buffer around the school and mapped the features occurring within that boundary. There's also use of residential buffer zones. This is where participant addresses were identified and geocoded, and then as either a circular buffer around the participant's residence was demarcated, and all features occurring within were mapped out, or a network buffer is used whereby this looks at the travel distance from the place of residence to a determined within a determined distance. Okay. The other unit of measurement that we noted was the use of public transport stops, where this was particularly in China, where the city map indicating the metro stations where it was used, and researchers then went around each of these stops and looked at the environment features of interest. It's also important to note that the use of public transport stops particularly looks at the former transport network and does not take into consideration informal transport stops. And then lastly was the street segments, where a particular part of the of a segment was of interest, and therefore that's where the researchers went and conducted the research. Okay, so moving on to the mapping tools that were used, we identified 3 types of mapping tools. There's your traditional maps. These are either analog, the printed ones, or digital maps. These were used in 18 studies. They observed global positioning systems used in 10 studies, as well as GIS systems used in 37 studies. Importantly, studies in some instances, studies used multiple tools simultaneously, and therefore the numbers you see in brackets here are non-cumulative. In addition to these mapping tools, studies also used environment audit tools such as the goods and services inventory and the QBIS tools. What these environment audit tools were useful for was that there's some aspects of the environment that can be geographically mapped. And so, for example, looking at the food environment, let's say looking at the food environment, one would map or identify the exact location of food outlet store, and then use an environment audit tool to then record the exact types of food that are being sold within that establishment. And similarly for the physical activity environment, one would actually then go and look at, say, they have identified the presence of pedestrian lanes, and then the environment audit tool can then be used to take note of the condition of these pedestrian lanes. We're not in so for all of the studies, except for one studies, only the data was collected by the researchers with minimum participation from the community members in which the research was being conducted in. So for the analog and digital maps, these were obtained from primarily 2 sources. Firstly was from the city authorities, for instance, the city of Cape Town. And these maps were then used for canvassing features of interest. And in one particular study in Maputo, they printed out the maps, and then the researchers went around the neighborhood and noted the exact location, noted an estimation of the exact location where they came across food vendors. The second source was the publicly accessible online maps, such as Google Maps and OpenStreetMaps, and these were used to geocode environment features, as well as verify geocoded physical addresses that were supplied, for example, by the municipality. So to illustrate the use of maps in this study, this is an example from one of the studies that we reviewed. It was conducted in Kazakhstan, and they were particularly looking at the availability of cigarettes, bread, and fruits and vegetables within pre-specified regions in the city. And so each of the shapes here represents a map of that region, and within each of the shapes, there's different types of dots represent the different types of food, the different types of food outlets or different types of food that they observed within those regions. Then another technique that was used, so this is in the one study that used participatory methods, a participatory approach, whereby the researchers and the community collaborated. So they used a balloon mapping technique in Nairobi, Kenya, and and 3 informal settlements. And so using this technique, a helium balloon is inflated. And then once it's inflated, a digital, inexpensive, it can be second-hand digital camera is then attached at the base of the helium balloon, and the helium balloon then flies over the area. And then as the helium balloon flies, the camera captures images at different altitudes. Then at the end of, so looking at the image at the bottom, at the end of this mapping exercises, the researchers and the community collaborate and putting together the different pictures to provide an aerial photograph of the food environment. The second tool that we noted was the use of GPS. So the GPS devices that were used were either mobile phones that were GPS activated or GPS standalone GPS gadgets. And with these tools, researchers physically went around and pinpointed the exact location where they noted a relevant environment feature. In places where they were looking at either food establishment or buildings, the researchers would either geocode the location at the entrance or within the establishment itself. So some of the features that were mapped, that were geocoded using this tool included destinations, bicycle lane, quality in tandem with environment audit tools. And then for the food environment, they mapped retail stores and informal food stores. To illustrate the use of this tool, a study in Accra, Ghana, was looking at the spatial distribution of out-of-home cooked foods, highlighted in red, convenience stores highlighted in green, as well as the fruits and vegetable stands that are highlighted in yellow. Sorry, the convenience stores are highlighted in yellow and the fruits and vegetables are highlighted in green. So looking at this map, it's apparent that most of the food outlets in this area were sold out-of-home cooked foods. So lastly was the use of the GIS, and the GIS method uses a diverse number of information sources, and so it collects data from different sources, and then once this data is then collated and analyzed and to give a visual map of an area. The GIS method requires input from 2 sources. Firstly is a geographical map. So this can be your publicly accessible maps such as Google Maps, or this can be maps obtained from a city authority. It's important to improve accuracy of the GIS technique. These geographical maps need to be updated such that they represent the current geographical landscape. In addition to these maps, there's use of georeference photographs of tabular information. For instance, the georeference location of recreational facilities within an area or restaurant types within an area. The GIS was particularly used to illustrate the location, proximity, or density of the relevant environment features. So to illustrate the use of this method, to your left here is an illustration that shows that the GIS method uses different data layers, information sources noted here as data layers, and these are layered to provide a map that you see on your right here. So this particular map was looking at the spatial distribution of supermarkets in the Cape Town metropolis, and so each of the different dots would highlight the different types of supermarkets, and the different color and the background colors would look at the density of those particular areas in which the study was conducted in. Similarly, in a study conducted in Romania that looked at accessibility to informal green spaces, they used the GIS technique to map the location of these informal green spaces relative to the addresses of study participants. So from our study, we noted that there was there was very limited research that had been conducted in low middle income countries looking at food and physical activity environments. And of this research, most of it was actually conducted in 2 regions. For both physical activity, it was conducted in the Latin American Caribbean region, and for the physical activity, there's more research coming from China. Other regions, notably Africa, was significantly underrepresented in both environments. And this means that there's very limited evidence of what's currently going on in our food and physical activity environments. Secondly, the digital mapping techniques that were used, the GPS and GIS methods, are relatively inexpensive to carry out the research and often require skilled personnel. And this is a particular concern in resource-poor settings, whereby it is still very important to map out these environments, but financial resources or human resources may not be available to conduct this. And so a way to bridge this could be through participatory mapping methods. The mapping techniques that we use, particularly looking at the GIS technique, may not always accurately capture LMIC conditions, given that we know that the LMIC urban spaces are rapidly changing, and the baseline geographical maps that are used, such as Google Maps, as well as maps coming from the municipality, they tend to be out of date, and as a result, sometimes the information that has been captured by the studies may not be up to date, and may not represent what's actually currently happening in real time. Another issue was that across the studies, one of the steps was to first set out a sort of boundary in which these features were going to be made. So that is good in that it obviously concentrates your study, but at the same time, it does not capture the fact that in some instances, people interact with their food and physical activity environments outside of their residential neighborhoods. For instance, people might buy their groceries in their places of work that are far away from their residential neighborhoods, or they might engage in physical activity in facilities that are again outside of their delineated residential buffers. Another thing is that the data collection was predominantly done by trained research personnel. So this is great in that it improves data quality as well as data collection. But at the same time, given the nature of informality in low mid-income country urban spaces, there is a nuance and there's a possibility that the researchers might actually miss out on contextual factors that actually do make a difference in the physical activity environment. For instance, if one was mapping using the street network, for instance, this would overlook alleys that people sometimes use as shortcuts to get between 2 points, as well as for the food environment, you might miss out on food sources that are specific to a particular context. So going forward, it's important. There's an urgent need for advances in mapping tools for LMICs, and particularly inexpensive mapping tools. And one way of doing this, as illustrated in this presentation, is the use of the balloon mapping technique. There's also need to promote participatory mapping approaches, such that there's a balance in capturing the lived food, both the objective food environment as well as the actually lived food and physical activity environments. And lastly, given the relatively younger population in some of the LMIC regions, such as Africa, it is important to engage the adolescents and youth so that they also have a better understanding of the environment and can contribute to ongoing research. I'd like to acknowledge my co-authors, as well as the IDRC who funded this research project. Thank you.
Great, thank you, Trish. That's awesome. I'll just hand over to Leslie for the Q&A.
All right, thanks so much, Trish, and a very interesting paper and a very relevant paper. So open for comments and questions. I know there are people working on food and obesity and also on GIS and public health. Any comments from anyone? Okay, I'm going to kick off then, and maybe people will join. I'm particularly interested in advertising and sort of the role of advertising in communities. That didn't seem to come out in many of the studies. Is that the case from the review?
So can you please repeat that?
The role of advertising in shaping food choices and the density of advertising in communities and whether that influences food choices. Did that come out in the review at all?
It did, but particularly for studies that were looking at the school environment. I think it's also to do with the interest around the relatively high interest around advertising towards school-going children. So there was a bit of that, but there weren't a lot of studies looking at that in particular.
There is maybe a gap. I see Pancho has a hand. Welcome back. Nice to see you, Pancho.
Hello.
Yes, go ahead. Nice to hear from you. You're up. Speak. Pancho, you're on the floor. Pancho, we're not hearing you, even though you're unmuted. Okay, while Pancho's trying to connect again, I guess, are there any other comments or questions people want to make? Maylene, over to you.
Hello, can you hear me, Leslie?
Yes, loud and clear.
Thank you. Thank you very much, Trish. I think your presentation shows to me just how complex studying these environments are, because food environment and physical activity environment and the two in combination overlaid with other factors that determine what becomes an obesogenic environment is so complex. So I just wondered in the mapping, how did you come across any studies that take into account, because of course people don't just access food or physical activity in the environments in which they live. So they go to work, or they might go elsewhere and exercise both food choices and physical activity choices outside of their immediate environments. And I do understand, of course, that mapping is not the only source of data that one would draw on. You'd also draw on interview data and other kinds of data to put together the complexity of people's environment. But just in terms of mapping itself, how do you overlay the different spaces that people access for physical activity and food choices beyond the places where they live? So yeah, so if they go to 3 or 4 different spaces in a week, how do you actually overlay that kind of information in a single map? Or can you? Is it too complex to do?
Thank you, Maylin. You can do it. It obviously would need for you to also have, in addition to the mapping exercise, you also then have to do some sort of interviewing to then be also not the places that people say they go and obtain their food sources from. And then if you're then able to georeference the places, I think that approach can be utilized to sort of like then provide an overview of, where study participants obtain their, interact with their food or physical activity environments.
Okay, thank you.
I see Pancho is back. I don't know if you have able to ask your question. Pancha, are you able to ask your question? Akhil, over to you.
Thank you for an interesting presentation. I didn't follow the I didn't attend for the whole session. So what I'm asking might have been covered already. I just wanted to get your sense about the using GIS information and these type of tools in Cape Town themselves. How well developed the GIS information system is here in Cape Town and how accessible it is. I just wanted to review on that.
For the GIS information, it is relatively accessible, but one of the main issues is that, especially when you're looking at mapping informal settlements, for example, or informal features of the environment, is that a lot of times the baseline map, so for example, let's say using Google Maps or municipal maps, they tend to be relatively outdated. So that's one of the major challenges, particularly in LMICs, where so when you then conduct your study, if, for example, you're solely using the mapping source, you're solely using the geographical maps, you then run the risk of them not representing information that might actually be out of date. So there is, for the GIS, I think it's important to use the mapping as well as some sort of environment audit tool such that you can able to draw parallels as well as take into consideration the rapid changes that are occurring in certain parts of the cities.
Okay, thanks. And what about the bureaucratic process in trying to get the information in places like in Cape Town? Is it relatively easy to access, or are there a lot of processes in trying to get the information in terms of approvals and things like that? Is it quite simple?
It's relative to the space, but across the board, it's relatively a bit more complicated than just going in and asking for the map.
Okay, thank you.
Okay, I see Pancha, your hand's up. Are you able to ask?
Yes, can you hear me now?
Now we can hear you. Welcome, welcome. Go ahead.
Thank you. I just wanted to ask, I'm not sure if I heard this because your presentation, went so quickly. Thank you so much for this work that you've been doing with colleagues. It's really fascinating. And I have two questions. My first is, I didn't actually see in your slides a mapping of all the informal markets or places where people can buy food informally. And I see there's a GPS food environment stand sales. Okay, so that's what you mean by informal, those stands and stalls. I guess you did map them, but do you think you may have missed some? And if you did, is it a lot, or you probably got them all? Because I'm sure these informal markets come and go, and some of them are maybe not legal. They're not where they should be. At least that's the case in our city in Namibia. It's so highly regulated. And then the other question I wanted to ask is, what do you think you can take this research forward to actually talk about incidents of eating disorders in the city? And I guess there's this perception that, eating disorder is just a thing for wealthy white people. And if we could get this data, do you think it would map in that way, or do you have an insight there? Thank you.
Thank you for the question. So to answer your first question, so this particular study was a review, and so we did not actually collect the data ourselves. But with the study that you mentioned, they did. Sorry, are you referring to? So which slide are you referring to exactly?
Slide 18. You say you have the data from one particular. Yeah, there you go. Slide 18, the GPS food environment.
Okay. So for this particular study, the researchers went around physically and noted, firstly, the location, the exact location, and secondly, the type of food outlet that they saw. And you're right in the sense that because it's an informal space, what you see today might not exactly be what you're going to see if you were to return the following day. And so this So most of the maps provide a snapshot of what's going on that at the time in which the data was collected. And so one way of sort of having more continuance would then be if there's the sort of like ability to do the same exercise across at different time points. So say, for example, every week or every 1 month or so, whatever time interval is decided upon. But again, that raises the issue of feasibility as well as resource constraints. And to answer your second question around eating disorders, so I think that speaks to a broader field around obesity and around obesity. And so this type of study provides information from one aspect of it. For instance, we're just getting a sense of sort of the objective food environment. And this, if you then triangulate it with data from other studies that specifically looking at measuring the prevalence or incidence or understand the nuances around eating disorders within the area, you can then collate, you can then triangulate the data to get a sense of what's going on. But one wouldn't really be able to make direct inferences on that.
Thanks, Trish. I see Meryl's got her hand up. Meryl?
Thanks, Leslie. Thanks, Trish, for the presentation. Sorry that I joined a bit late and I missed out. Also, just having some internet trouble with this during the question session. So I don't know whether someone else probably mentioned this, but just for my own information, it has been addressed before, but I would like to find out, were there any studies on participatory GIS methods in there? Sorry if I missed that out. Especially when it comes to, informal settlements and informality, there's a lot of tools that you can borrow from, rapid rural appraisal methods and participatory GIS to get more of that attribute information as well as the spatial information. So if you could just guide me if there were any PGIS methods used.
No, there weren't any traditionally participatory GIS methods. The one study that I described earlier we looked at was more of a mapping exercises using the balloon mapping technique. And within that study, they actually did speak around the need for more participatory GIS and how to then go about doing those sort of studies within the LMIC context. So I think there is more research that has probably been done from the time of our review, and yeah.
Okay, yeah, thank you. It's just just again like a participatory GIS where residents and like themselves can map out their food sources and the types of food. So you'll get a really rich amount of information from attributes information as well. Thank you.
Thanks for raising that, Meryl. Trish, I was intrigued by the helium balloon. I want to put the slide up again.
Okay, yeah.
Trish,
so there's background noise on my side.
I wonder if you can put the slide up with the helium balloon again, because I was quite intrigued by how it worked. So the community how did they steer the balloon to take the pictures? Or does it float? Do they pull it, or what do they do?
It floats, basically.
It just floats around, so it sort of takes pictures just arbitrarily according to how it drifts.
Yes, I was also reading up around it, and there are some that can sort of like be directed in terms of like where it can flow. But for this particular study, it was just floating around. But there's considerations around the wind direction and the general meteorological conditions. But, yeah.
Okay. Well, I'm sure people had a lot of fun doing that.
It is. There's actually a video online. I can add a link to that with the recorded a video of how they actually did this.
Okay. Are there any other comments or questions? So I'm aware that the Department of Health is reviewing its. Sorry, there's a comment here. I can't see the comments very well. Okay. All right. The Department of Health is apparently reviewing its 2015 to 2020 prevention of obesity strategy. I've actually just seen a notice come around inviting people to participate in the review. What do you think that your work could help in that review? And what comes out of your review that could help the department in reviewing how it's done in its own strategy?
I think one of the things from this is that it can help to sort of like get if there's a connection, like what the policy states or what the policy recommendation or the laws that have been put in place, if that is actually what then is being observed at the city or neighborhood level. And so one is able to sort of draw parallels around what the food environment is actually like and what the food environment is actually like. And also it can also add information, particularly around the informality in the informality aspect of the physical activity and food environments, because a lot of times, sometimes the policies tend to focus more on, more tangible, objective data that may not necessarily represent what's going on in informal spaces.
So I took a look at the policy, and they have 2 paragraphs on research, and they have 4 paragraphs on monitoring and evaluation. So maybe your work would be able to suggest how the next version of the policy might be better able to evaluate what's going on, and also how to make use of GIS-based mapping and research. So I've just posted the URL for the policy, and if somebody wants, I can forward them the email that's inviting organizations to submit to this process of review. Are there any other suggestions, comments, questions? So I think this has been a really interesting presentation, because this method is applicable in a lot of different ways. You're applying it to diet and exercise, but I know people are applying it to alcohol advertising and impacts of the alcohol lockdown on injuries, etc. So I think the method is really interesting in many different contexts. I see Mailene's asked me to send the email out for that policy review on obesity, and I'll send it to Carmen just to distribute in the school, and I'll do that later. Okay, if there are no more questions, I just want to thank you, Trish, for a very interesting seminar. It was really well done, and look forward to seeing it published. And good luck with your PhD. Okay.
Thank you.
All right. Thanks, everybody.
Thank you,
Thanks
everyone.
all. Okay.
Thank you.
Bye.
Bye.
Thanks, everyone. Thanks, Trish.
Thank you, Raylan.
Thank you.
Mm.